I'm the clinical program lead for team training at the AHA. Welcome to our monthly webinar series. And this month, we're excited to present patient and family caregiver engagement, the key to enhancing teamwork and communication. We're really excited about it. But before we dive in, I'm going to go over some rules of engagement and just a couple of announcements. So Sue, you can go ahead and slide forward. Beautiful. So you can access audio by listening in through your computer speakers or through your phone. If you're having issues, you should be able to access the toolbar at the bottom to switch to either phone audio or computer audio. Please note that you will be in a listen-only mode throughout the presentation today. We're going to moderate a Q&A session at the end with our speaker. So if you have any questions, please chat them in throughout the presentation. If it's a technical or a logistical question, we'll answer that in the moment. But if it's for our speaker, we'll likely save it for the end unless I see an opportune moment. I can slide that in during the webinar itself. But don't worry, we'll get to your Q&A. So finally, please note that this presentation is being recorded, and we will notify all registrants when the recording is up on our website. So we can go forward, Sue. We are happy to offer continuing education for our webinars, but in order to claim your CE credit, you've got to create a Duke OneLink account. This is a one-time only setup, so if you've done it before, you should be good. But if not, my colleague Kara has chatted in those instructions, so you can get that all set up. You can also refer to the email that was sent to you this morning with the attachment. So following the webinar today, please text that code you see on your screen, YECWEV, to the number you see on the screen. And again, don't worry, we will share that at the end as well. So we can go ahead and move forward, Sue. We'd love to tell you about a couple of upcoming team training events. We have in-person master training courses happening at our regional training centers this fall, from New Orleans to Los Angeles. Pick your fun on the run and then come see us to learn how to be a TeamSTEPPS master trainer. We also have another webinar coming up for our monthly series on October 8th entitled Purpose to Performance, Turning Hospital Silos into Strategic Team Results that Engage and Last. It's going to be another just fantastic webinar for you. We hope to see you then. Finally, next slide. We also want to make you aware that if you're looking for a more customized training solution, we offer on-site trainings where AHA team training will actually come to your organization to deliver anything from a 2-day TeamSTEPPS master training course to a comprehensive training program that spans multiple on-site trainings and virtual coaching to truly support your TeamSTEPPS engagement and help to foster ownership within your organization. So when you have a custom course that allows us to customize the content to our audience, meet you and your hospital or health system right where you are. So you can visit our website to learn more and complete a brief questionnaire where one of our team members will get back to you and get you started on a solution that's tailor-made for you. Okay, so with that, we can change screens. I would love to introduce you to our phenomenal presenter today. Welcome with me, Sue Deaton. She's the Chief Engagement Officer for Patient-Centered Innovation, Inc. She's also faculty at the Institute for Healthcare Improvement. We are super excited. She's here joining us today with this very important topic. And Sue, I'll turn it over to you to tell us a little bit more about yourself and your work.
Thank you, Rhonda. It is indeed an honor to be back with the AHA Team Training Group, to be a part of today's presentation, but more important, to have an opportunity to have a conversation with everyone on the call today about your work, your commitment not only in improving teamwork and communication in your organization, but in how you are engaging patients and family caregivers as active partners on the healthcare team. So we're going to have about 40 minutes together to review some content, to present to you some examples of how you can elevate the work that you're doing. But I do want to emphasize that this is a dialogue. I'm going to have throughout today's presentation several opportunities for you to use the chat box to talk with us about your experiences, your challenges, and also to give us some examples of what you're doing to demonstrate the value and the importance of patient and family engagement in your organization. So let's jump off with the first opportunity for you to engage in this conversation. And I'd like for each of you on the call today to open up your chat box and to describe in one word what patient and family engagement means to you. And I'd like for you to do this to really give us a chance to see how you're viewing this particular topic. And I'm thrilled to see the chat box is blowing up. I'm seeing partnership, transparency, collaboration, patient-led, safety, trust, respect. Wonderful. Love seeing the one words, love seeing the level of engagement that's coming in the chat box, empathy, listening, advocacy, partnership, and I'll just call out, Julie, the right thing to do. Thank you so much for using the chat box, for sharing your one word. And I'd like to come back to what you've shared in a few minutes, because I think it's critical that we walk away from today's presentation with a shared mental model of not only what we mean when we talk about patient and family engagement, but what that looks like in action. So today's objectives are pretty straightforward. First of all, I'm going to take a few minutes to describe some of the key changes in TeamSTEPPS 3.0 that addressed the opportunities to engage patients and family caregivers. And then we're going to take a few minutes to explain how patient and family engagement, and I'll refer to that from henceforth as PFE, how that can support patient safety efforts across a variety of healthcare settings, not just in acute care settings, but in community-based settings and physician offices, pretty much anywhere where patients and family caregivers are interacting with the healthcare system. And then we'll close by identifying opportunities to involve patients and families as partners across various segments of healthcare delivery. Much like you did in the chat box just now, giving us your one word, I want to share a few definitions of PFE that will ground us in a shared understanding of what patient and family engagement looks like in action. Many of you may be familiar with the Institute for Patient Family Centered Care and its trailblazing work over the last 3 decades in helping to accelerate the practice of patient and family centered care across all settings of healthcare. Their definition of patient and family centered care is really focusing on grounding that care in beneficial partnerships, recognizing that patients, families, and healthcare practitioners are partners, all on the same team. The Agency for Healthcare Research and Quality, or AHRQ, defines PFE as, again, a partnership in which patients, families, clinicians, all hospital staff are working together, again, on the same team to improve care quality and safety. And then last but not least, CMS, their definition emphasizes that it's about action, about creating an environment where patients and families are collaborating. They're collaborating with their providers, with all of the other hospital team members or office team members or practice team members to ensure that the health goals are based on evidence, values, and preferences. The key, though, when we think about looking at different sources of definitions, is the same principle continues to shine across all of these definitions, and that's that we are all on the same team. We're all team members. So when you hear the terms PFE, I want you to also think about the core concepts. And I'll go back to the chat box and say, you've covered many of the core concepts in your one word in that chat box. So one of the core concepts is dignity and respect. And this is where we demonstrate that the perspectives, the needs, the values, the beliefs of patients and families are valued, that they are recognized, and that we embed their needs, their perspectives into care. Another core concept is information sharing, and this should be very familiar with all of you on the call today, how important it is that we're communicating, since that's one of the teachable, learnable skills of the TeamSTEPPS training. So information sharing, information that's transparent, it's clear, it's concise, it's in recognition that patients and families need to know how their care is evolving, what they need to do in their role, but that's done because we're communicating in a way that is respectful and trusts the patient's role. Participation. This concept recognizes that patients and families are active players on the team, that they have a role, that they have responsibilities, and they have the opportunity to actually be a player, an active, engaged participant in the care that's being delivered. And last but not least, collaboration, a core concept not only in PFE, but also in Teams training. So I'm so appreciative of the fact that many of the one words that we're seeing in the efforts to deliver patient and family centered care, that you're recognizing that in your one word. So let's go to the next slide and let's talk a little about why PFE is so important, and just a very brief timeline of where when we look back in history, where patient and family engagement really became a critical component of patient safety in healthcare. Many of you may have remembered the 1999 report by the Institute of Medicine called To Err is Human. And in this report, there was evidence that we were working within this healthcare system. The errors that were occurring in healthcare were not because of bad people, but because of good people working in systems that may have been broken, or that processes in systems were not working well, or they were outdated, or not focused on what patients needed or wanted. And also not focused on what healthcare providers felt were most important. And in a follow-up report, the Crossing the Quality Chasm is where we clearly saw that in order for us to reshape the safety of healthcare in this nation, we needed to focus on the delivery of safe, timely, efficient, effective, equitable, and patient-centered care. So they introduced 6 aims, one of which involved recognizing the patient as an active participant in the delivery of healthcare and in the advancement of healthcare safety. Just more recently, in the last 5 years, the Institute for Healthcare Improvement convened a national steering committee for patient safety, and that collaboration among 27 national organizations created a plan to advance patient safety that at its core recognized the critical value of engaging patients and families as partners in advancing patient safety. And that National Action Plan has in it 4 core elements. that are the kind of the undergirding for this national action plan. And in each of these slides that, as you see in the chat box, you'll have access to, there are links to all of the references where this material was selected. So you'll have an opportunity to go in and get access to all the detailed information behind this content. But in the National Action Plan, you'll see 4 core areas: culture, leadership, and governance, learning system, workforce safety, and patient and family engagement. Patient and family engagement is considered one of the core areas of the National Action Plan. And in this action plan, there are key actions that are identified to support PFE. Those actions include co-designing care delivery, recognizing that patients as partners should be actively engaged in defining the processes of how care is offered, that there should be some competencies for all healthcare team members, including patients and families, that focus on their roles in addressing patient safety needs, that involving patients and their family members or caregivers in leadership and governance is part of what helps us continue to advance patient safety together, or as the title of the report mentions, Safer Together, the National Action Plan to Advance Patient Safety. So ensuring equitable engagement, making sure processes are accessible, that's another key action that's defined. And there are tactical approaches in each of these areas in the National Action Plan that ultimately demonstrate ways that you can promote trust and respect for patients and families and their care partners, so that overall we're looking at a comprehensive approach to improving patient safety together, and patient and family engagement is a core element of that structure. Now, there's no surprise for anyone on the call today that healthcare is going through just an incredible amount of change. By virtue of the fact that we're doing this training virtually, many of you have over your careers seen healthcare delivery shift to being one that involves not only virtual but telehealth care. The changes in technology, the advancement of AI, the use of big data to analyze and impact the way in which we deliver care, the time and workload constraints that you're dealing with, the regulatory challenges, the added energy and effort that we're spending on caring for ourselves as well as caring for others. You're delivering care in this context, and we recognize that when we are looking at engaging patients and families, we're engaging patients and families because they can help us during these complex and sometimes chaotic times, because they are additional team members. So let's think about them as we move forward in today's presentation, about how we can make sure that we are maximizing the roles and responsibilities of all team members, including the patients and families. So we're going to start out by describing some of the key steps, key changes in the TeamSTEPPS 3.0 that addressed patient and family engagement. I was part of the technical expert panel that helped to develop the TeamSTEPPS 3.0 curriculum. So I was thrilled to see that in this curriculum, there not only was an effort to consolidate content across various care settings and to have shorter, more modular course design and more active learning strategies that use things like group exercises and discussion formats and an intentional leveraging of technology changes, including things like looking at well-being across teams and telemedicine. But one of the key changes in TeamSTEPPS 3.0 was the increased patient focus. There was an intentional effort to increase in the content in the curriculum patient participation examples. There was simulation training specifically to share with patients and families, and also a guide for patient and family caregivers. I'm especially proud of the PFE resources that included notes for the patient and family that spoke specifically to their role and why it matters that they not only be active participants in their own care, but they see what organizations are doing through the team training skills and techniques and tools, the effort that organizations are spending to ensure their safety. So there's a segment within the 3.0 materials that speaks directly to the patients and family caregivers, saying you directly see the impact of effective team leadership or poor communication on your individual safety, on staff morale and burnout. And we want you to know that you play a part in ensuring that teamwork and communication is effective. You're a member of the team. We're going to include you in things that not only you can do, but things that you're going to see your team doing to make sure that they are focused on your safety and on the safety of the rest of the team members. So there are resources that are referenced in the notes to the patient and family segment that help the patients and families to not only feel an active participant, but also to recognize what others are doing to keep them safe. So I want to pause here and just ask if you'll use the chat box to describe, is there a PFE resource in TeamSTEPPS 3.0 or in the AHA team training materials, because they have adopted and adapted many of the patient-facing resources for the AHA team training. Are you using any of the PFE resources now in your organization? Or are there some resources that you just heard about that you are planning to use in your organization? So I'm saying yes, please feel free to put into the chat box what you are doing now or what you might be planning to do based on what we just shared. I see Zarina has just shared that yes, she is using some of these resources in her organization. I'd love to hear from others on the call. And if you're not using these resources or you're not sure which ones you might be interested in using, I want you to listen through the rest of today's presentation so that you can discover some ways that you can elevate your efforts in patient and family engagement. So in this segment, we're going to talk about how patient and family engagement can support your patient safety efforts across a variety of healthcare settings. And again, as information comes into the chat box, I see Teresa says we have a patient advisory team that's well attended. Great, Teresa. We're going to talk in just a few minutes about how PAFACs or patient advisory teams can be an active part of your AHA team training efforts. So most of you, if not all of you on the call, should be very familiar with this particular diagram, the TeamSTEPPS evidence-based framework that shows the 4 teachable, learnable skills that are core to the TeamSTEPPS model. When we look at this particular visual and we think about how the 4 elements of communication and team leadership and situation monitoring and mutual support wrap around that core, we clearly recognize that that visual in its graphic shows that we're wrapped around the patient, the family, and the care team. The hands are interlocked. We're all on the same team. This is a visual that clearly demonstrates that we believe not only do these skills matter in helping us perform better as a team and communicate better as a group, but that we're all here for that purpose of collaborating and working together. Because in the desired improvements, we see that we, in order to have that wraparound core benefit, that we have to have a shared mental model, that we have to have mutual trust and orientation as a team. And we do this because we know that by creating a highly reliable environment or processes, we can improve safety and improve the overall performance as an organization. And a core desired improvement is that we sustain the teamwork and communication in a culture that is committed to patient safety. So I want to talk about each of the four teachable, learnable skills and how they connect to PFE. So when we think about communication, we think about the exchange of information, the fact that someone's sharing information, someone is receiving information, and we consider that in this particular teachable, learnable skill, we're doing this because we know that by sharing information in a clear and concise manner, we can prevent errors, we can reduce misunderstandings, we can ensure that we are making accurate, timely, effective diagnoses, and therefore the treatment will be effective because it matches what the patient needs. But in order to do that, we have to have active listening. And the information must be clear and concise. And we know through Teams training that we need to meet as a team. We need to huddle. We need to share information as a group, and that we use our verbal and nonverbal language to impose a sense of rapport and camaraderie, and also to demonstrate empathy. So think about this line of interaction with communication having a purpose to prevent errors, that we are demonstrating that through these particular skills. So think about the various ways that we do that with patients. So when we think about callbacks and checkbacks, think about when you ask patients about allergies or whether or not various treatments had the desired impact. You're doing a callback or a checkback with the patient. When you're thinking about callbacks or checkbacks with your team, think about, are you including the patient in those conversations? We think most often about callbacks and checkbacks as having just a focus on individual patient information, but are we checking back with the patient to see how we're working as a team? When we're doing handoffs, we think frequently about handoffs among the team members, but we are doing handoffs with the patient when we have a shift change or when we move a patient from one unit to the next. So think about handoffs from the patient's perspective and where the patient has a responsibility in sharing information and providing clear and concise information, or where the team has an opportunity to, through, let's say, bedside shift report, actively engage in that handoff or that briefing opportunity. I see that Ricky said in the chat box that in the community, we usually collaborate with the community health center, but many times the practitioners have less skills and knowledge. I think that that is a valid point, and clearly what we're trying to do in team training is to make sure all team members have the skills and the knowledge, and that includes the patient. So when we're doing teach back, whether it's wound care or on medications, we are not only doing teach back among the team when we're trying to train other health practitioners, or Ricky, in your case, in the community health center, but we're also talking about how we are teaching back to the patient about their individual care, but also, are they seeing our efforts relative to teamwork and communication? Are we asking for feedback and reflection? So think about how in this particular teachable, learnable skill of communication, it includes the patient in those key communications designed to prevent errors and reduce understandings and ensure that we're all actively listening and asking for feedback. So the same thing is true when we think about team leadership. And in the four team diagram, we recognize that there are lots of groups that are involved in teams, leadership, but that it's important to recognize when we're talking about the core team and about leadership, that we're including the patient in that discussion as well. So we know that through team training, effective leaders focus on maximizing team performance and ensuring that information is being shared and that resources are available. And we do this as effective leaders by setting clear goals. But keep in mind, as you're setting goals for the team, those goals should include what the patient's preferences are. And when you're assigning tasks, keep in mind the patient may have some tasks as well or some responsibilities. And so as the leader is ensuring actions are understood and sharing information and adapting to changes, they're creating a more cohesive team and doing so with the patient actively at the table, a part of those conversations. So think about things like when you have briefs at the beginning of a shift, or maybe at the beginning of a procedure or discharge. Think about the patient as part of that brief, and where possible, incorporate the patient physically in that conversation. Or when a situation changes, including assignments on your team, huddling with the patient at the bedside or at the exam table side or in the community office, thinking about when situations or assignments change or when something triggers the need for a huddle, have you incorporated the patient in that conversation? Or debriefs. This is a great example if you're doing bedside shift report or a debrief after a complex procedure has occurred. Think about how you would include the patient in that debrief and recognize the patient's input, because as effective leaders, you're ensuring information is being shared among all team members, and think about that patient as a resource as well. And then last but not least, include the patient wherever possible. And I do want to address, Ricky asked the question, which one is better, patient-centered care or all part participate equally? I love the use of patient-centered care, not to imply that the patient's at the center and no one else matters, but that we're thinking about that in terms of the patient's centricity. We're focused on the patient. We recognize that we can't have patient safety without the patient. Patient and family engagement, that term is very much an action-oriented term as well. So we're talking about engaging patients and families as active partners. So I want to talk about how that then play out when, in terms of language and in resources in your organization, when you are essentially recognizing that all team members contribute. Some may contribute different roles or different skills. And Michelle, I'm going to get to your question in the last portion of today's presentation. So last but not least, the teachable, learnable skill of situation monitoring. And again, for those of you that are well-versed in the team training, you know that in situation monitoring, it involves an individual skill, an individual outcome, and a team shared mental model. So the individual skill is actively monitoring, or scanning the environment. So this is where individuals on the team are looking at what's happening around them. And then individual outcome is when there is a level of awareness of what this means. I've been checking out my environment. I'm looking at how people are behaving, what they're saying. Now have developed an individual outcome of awareness of what this means. And then I'm giving a team shared mental model of what we believe is happening and making sure that we're all in agreement, or that we all have an opportunity to give insight into what we're seeing and what we're thinking, so that as a team, we're working together. We're working on from the same perspective. But I put this particular visual up here about the patient lying on the floor looking up. and looking at their team and whether or not, as they're scanning their environment, are they seeing everyone's working in sync, hands locked? Is there awareness that the team is coordinated and has a shared mental model of the situation? And are they in a position to be able to share their perspectives? So just taking one of the TeamSTEPPS tools, STEP, when we think about sharing the status of a patient or looking at the team members' sense of stress or workload or their environment, whether or not they have the information or the equipment they need, or are we getting progress towards the goal? And in this case, the patient's goal. How might you include the patient in executing this particular tool? How might you engage the patient in understanding how they see their status? How do they view the way that team members are working together? Are they picking up on stress levels or workload or information or equipment gaps? And what's their perspective in terms of their progress? So the key reminder here is that in order for there to be an integration of patient-family engagement and patient safety, we want to make sure that the patient's perspectives are considered, are incorporated, are asked for, and more importantly, making sure that we're recognizing that we can't have patient safety without the patient. And then last but not least, mutual support. When I think about mutual support in team training, I love the action words that are associated with mutual support because it's all about ensuring that we're collectively anticipating, we're supporting each other, we're asserting on behalf of our team members and the patients, and we're seeking information, and we are backing up everyone on the team and recognizing that that includes offering help, offering support. And I especially love the tool CUS and have worked in a number of settings where we've trained patients and families how to cuss, how to say, I'm concerned, or I'm uncomfortable, or I don't feel that things are going well. I don't feel safe. I think this is a safety issue, or I want to stop the line. So in this particular situation, we are recognizing that we really can't have mutual support on the team if not everyone understands how they can anticipate and back up and seek information and offer to support the rest of the team. So I'm going to pause there and ask you to use the chat box to describe one new thing that you've learned about PFE and patient safety. I see some conversation in the chat box about person-centered care, patient-centered care, engaging the family and caregiver. And I see Melissa said, love this reminder to teach the patient how to communicate. Excellent. Please include, let's hear from others that are on the call today. What is one new thing, or maybe something that you heard that you are actively practicing in your organization or in your team training work that demonstrates the intricate relationship between PFE and patient safety? So CUS, excellent. Oh, including patients and families in bedside rounds. Thank you, Christopher. And I love teaching the patient the use of CUS. Glad that you feel like that is something new, a new idea. Ongoing surveillance, or asking the patient how they prefer to communicate. Great, great. And Karen, I see you said you're using CUS within the system, but not with patients. Think about how that might work. I can tell you that the times that I've taught patients or family members or even patient family advocates how to cuss, they think it's really funny at first because they think that we're making a play on words. But when they realize the power of the stating the words, and especially think about how powerful using cuss could be when the rest of the team is using those words. So the team member is team's tool of saying I'm uncomfortable, or first of all saying I'm concerned, and then saying I'm uncomfortable, or this is a safety issue. They will recognize that this is part of your effort in your organization to keep them safe. And I see Brooke said an ER colleague taught me about reverse S-bar. Excellent. Using S-bar in reverse when assessing a patient from admission. Wonderful. And Teresa saying we're explaining why we asked for this name and birth date with interaction. Wonderful. The one of the key things to remember is that when you share the ways that you are working together as a team and communicating to keep the patient safe, it elevates the patient's sense of trust and respect because they know you're doing things to keep them safe. Keep putting in the chat box what you're doing now, or maybe what you've learned today, or a different view or perspective you've gained from being on this call today. And we're going to move to the last portion, and these are specific opportunities to involve patients and families as key partners. Someone mentioned earlier about utilizing their patient family advisor council, and I'll share that that's one area that has definitely gained traction over the last few decades. And I'm going to start by just sharing a PFE framework that is one of my favorites because the framework does such a wonderful job of mapping out the levels of engagement that can occur across a continuum. So we frequently think about patient engagement just at the bedside or the exam table side or the community health room side. And it actually can happen at levels above that. It can happen at a whole unit level or a whole hospital system or a whole clinic or an entire community health group. It can happen, though, in a continuum where we're not just giving patients information and doing one-way communication, but we're involving them in the decision-making about preferences in their treatment plan. And then to elevate that even further, having a true partnership and shared leadership where treatment decisions are based on the patient's preferences, but they're also actively partnering in the ongoing care. When this continuum happens at a unit level or a hospital level or a health system level or a clinic level, then it can move from just surveying patients and saying, hey, tell us what you think about this, to having hospitals and clinics and other settings involve patients as advisors on advisory council members, and maybe even at the partnership level, co-leading safety and quality improvement committees. Maybe they are co-leading or active members of your team's training groups, and being seen as contributing more than just being a passive partner. So look at this framework and think about this as you evaluate some of the ways that you are engaging patients and families as team members. These are just a few examples that I would say are at that bedside or exam table side or community health side where we truly treat them as team members. When we do true bedside shift report, where the patients are actively engaged in the conversations as we transition to new team members. That shared decision making. This is very patient-centric. It's focused on making sure that patients get the information they need. The communication is clear. This is also shown in TeachBack, where we're giving information, but we're verifying what was heard. Having caregiver support programs. These are opportunities for caregivers to learn some of the teachable, learnable skills so that they can be active members in the care process. Having shared medical records or open notes. These are other examples of where you can document your commitment to patients as team members. If you start to look at the other levels, whether it's at a clinic level or a community level or a acute care setting level, having patients actually sitting on safety teams or co-leading safety teams, or more importantly, maybe presenting at your TeamSTEPPS education sessions, or they are actually on the education teams that are designing the rollout and the a presentation of the TeamSTEPPS tools and resources. Patient Family Advisor Council, several of you mentioned that in the chat box. These are excellent ways to not just get feedback, but to share what you're doing in your team training efforts and getting feedback on how you can not only elevate the PFE work in your team training, but also to get their feedback. I see that someone put in the chat box that your team had trouble using cuss. So now you use pause please, which stops the team for clarification questions. A great adaptation to work for your culture. But think of the power of a patient being able to say, pause, please. I have a question about what you're doing, or I have a question about how the team is working together. So thinking about having patient advisors on your TeamSTEPPS committees or patient family advisors on governance boards who can also advocate and reinforce the wonderful work that's happening in your team training. In primary care practices, there are a number of tools that have been written that provide guides to improve patient safety by engaging patients and families using open notes, team-based care, where the patient is part of the team that's utilizing the TeamSTEPPS tools and resources. So here's another example, depending on your healthcare setting. There are lots of different resources that are available to help you show the PFE in action in your organization. There are assessment forms, there are checklists, a variety of different resources that you can use to elevate your PFE work. There's also I actually was part of the group that helped develop the roadmap for patient, family, and care engagement in healthcare. This cuts across pretty much all settings of healthcare, and it lays out strategies for change that can happen at a care level, at an organizational level. It has measurement and research guidance, as well as information on how to ensure accountability across an organization. So for those of you that are on the call today that may be organizational leaders who are ensuring team training is happening across your system or across your integrated system, this is a great roadmap and resource as well. So I want to close out in the next few minutes to allow some time for questions. I see some comments in the chat box that I'd like to call out, but I want you to think about patient and family engagement in team training and in patient safety, much like you would a boat that has multiple oars, and thinking about how vital it is for every person on the boat to be rowing in the same direction and to be utilizing their tools and their resources collectively to ensure shared mental model and shared knowledge. Think about if the patient was not on that team or was left out or was somehow on the shore and not part of rowing in that boat, the potential damage that could happen or the lack or the drift that could occur as a result of that. And think about what you can do in your organization that is a journey. It's a change over time. It's an elevation from where you are now to incorporating some of the new resources and tools that the AHA Team Training Group has put in place for your benefit and use. And as I close out and then turn it over to Rhonda to moderate questions, please use the chat box to describe how you will, moving forward, involve patients and families as partners. I see some wonderful examples in the chat box now, but would love for you to share your thoughts top of mind as you've listened to this content and thought about not only what you're doing now, but what you might continue to do to elevate your efforts. Rhonda, I'm going to turn it over to you for questions.
Sounds good. Thanks so much, Sue, for this really enlightening webinar today. I hope that it has gotten our listening audience really thinking about how important this topic is and how we can continue to bridge those gaps, which that we have traditionally had sometimes between our healthcare teams. I know I've been a bedside nurse for over 30 years. And so understand how some of the bridging of the gap that needs to happen. And it's really exciting to follow the work that's being done in that area now. So I see a question here that I'm going to go ahead and bring out. I have a question. 3.0 does not have team structure as one of the 5 principles. Why? I think the team structure emphasized patient family engagement as one of the principles before. Do you want to tackle that, Sue, or would you like me to?
So I think that if you look at the team structure that's in the core materials, there's the assumption that the patient is a part of the core team. And I think that when we were doing the curriculum for the 3.0, if you will look into the content and kind of dig into some of the resources, the simulation training, the slide decks, there is implicit and woven across all of the materials that the patient is part of the team. And I will say, from having been one of the early master team trainers back in the day, in the early 2000s, that wasn't explicit, and it was kind of implied, but it wasn't explicit. 2.0 had some references. They had a separate module for patients, patient engagement. TeamSTEPPS 3.0, it's woven throughout the material. So I dig and look and recognize that it's not kind of pulled out and said, oh, a separate thing. It's now part of the fabric.
I would concur with that, Sue. And if you really, in particular, it's the leadership principle or module that they have incorporated what was that separate module of team structure and that emphasis on patient family engagement. And that's been absorbed into the leadership module in particular in order just to elevate the patient and caregiver voice as part of the leadership of their own care and of the healthcare team. So, and I will mention too, the AHA team training materials, just like Sue mentioned, we fully adopted TeamSTEPPS 3.0, and we've taken extra care within our materials to actually take the TeamSTEPPS tools and invite patients, show them how to utilize those tools themselves within their own healthcare journey and as they interact with members of the healthcare team. So we've gotten very practical, very tactical about teaching patients themselves how to use the tools like SBAR or CUS or closed loop communication. So lots of synergy going on out there about the importance of getting that information into the hands of our patients. So I'm scanning here. Any more questions? Here we go. How can members of the community be involved with patient family engagement initiatives if the healthcare organization is not actively pursuing this engagement? Okay, so what I think I hear you saying, John, is the community is getting educated, but the healthcare organization in your particular area hasn't quite caught up with making patient family engagement the priority it needs to be. Sue, how would you advise this person to kind of start
Yeah.
addressing it?
So one of the things that many of you are probably aware of is the acceleration of not only information that's available to all of us, not just the health systems, but to every consumer, and also the intimate relationship among acute care settings, healthcare settings with their community. So their community screenings, their community presentations, there are survey opportunities, there are even if an organization is not, quote, actively pursuing patient engagement through some of the techniques or strategies that I shared earlier, there's a way for the community to be involved. Their community, whether it's senior groups, there's senior community-based groups, there may be groups that are organized to through the local public health department, or groups that are community education in general in your area. I would say that some of the opportunity lies in the community members to recommend that, to suggest that to their healthcare organizations, and to use information like what you just heard today to share. Look, here's a slide deck. The American Hospital Association has a team training program, and they are encouraging organizations to do this. Let's talk about ways that you can support this, how we can engage patients as partners. Every primary care visit, every visit to a physician office, there are lots of ways that that individual consumers can share what you're learning and share what opportunities are there, and to give examples of the successes that so many organizations have experienced by having patient partnerships core to their work. So I'm saying in a roundabout way that it's happened and shown success, not only improving patient safety, and sometimes organizations just need to get access to that data. So I would encourage members of the community to be involved by educating themselves, by sharing that education information with their healthcare organizations, and then encouraging them to connect with other organizations who've done it well.
Indeed. And I'll just double down on something that you put in the chat there about the new CMS patient safety structural measure.
Yes.
So if your healthcare organization in your community hasn't quite caught up yet with patient family engagement, trust me, they will be soon,
Yes.
because it is part of that new CMS requirement that patient and family engagement is addressed. And again, I'm happy to say that the AHA team training program, through their team training with TeamSTEPPS, specifically addresses multiple areas of the new CMS patient safety structural measure. So we're killing lots of birds with one stone there with TeamSTEPPS training. So why don't we go to the next slide? And as we finish out our last few minutes, I love looking at these takeaways here, where we've let you know today that TeamSTEPPS 3.0 offers refreshed training methods, lots of resources to put patients and family caregivers in their rightful place as valuable members of the care team. So patient and family caregiver engagement actually strengthens teamwork and communication in a variety of healthcare settings as we face the number of challenges that are in front of us. It's helping us embrace and overcome some of those challenges. And then lastly, that actively partnering with patients supports patient safety, and it also improves communication, enhances leadership, and mutual support among the healthcare team itself. So hope you're walking away with those great takeaways. As far as what's available for patients and families on the AHA team training website, if you go to the AHA Learning Center, there's an easy link to grab off the AHA team training website. You can go to this section and learn all about TeamSTEPPS as a patient or as a family caregiver. We have wonderful links that take you to great guides on how to understand TeamSTEPPS, what the training's about, and even how you can, making the case for TeamSTEPPS will give you some great tools, information in your tool belt to go to your local organization and say, hey, team training is important for patient and family engagement. So go to our website, lots of information there for the patient and family to learn about TeamSTEPPS. And then we also have more for the healthcare team. Yep, you actually flipped ahead, and that was just great, Sue. So if you're interested in team training at your organization, again, we have lots of resources for the healthcare teams themselves. Things like pre-implementation checklists. How do you get ready to bring TeamSTEPPS to your organization? What kind of resources do you need? We've got course materials, slide decks, facilitation guides, videos. So really, so much information right at your fingertips at the AHA team training website. Okay, everyone. So lastly, please complete the evaluation form that's going to appear on your screen once the webinar ends here in about 1 minute. Be sure and create that Duke OneLink account. If you haven't done so already, text that code within 24 hours to the number. That's what's going to get you your continuing education credit. So Thank you so much for joining us. We are at the top of the hour. Sue, it's been an enlightening experience, an affirming, inspiring time together. And we hope all of you take the opportunity to pass this webinar on to others in your organization. So take care, everyone. Have a great afternoon.